Bird flu is also known as avian influenza. It is caused by strains of the flu virus that usually affect birds only, but sadly, in the last few months, it has been infecting more and more humans, and one of the most common symptoms is one related to the eyes. Hi guys, Dr. Nagori, here with iFacts to explain symptoms and how to protect yourself. Bird flu symptoms can range from mild to severe, and in some cases, complications can be life-threatening. The most common early symptom reported in recent U.S. cases of human bird flu is eye redness and irritation. This is called conjunctivitis. Other symptoms include mild fever with a temperature of 100 degrees Fahrenheit or 37.8 degrees Celsius or greater, but patients may not always have a fever. You could also have a cough, sore throat, runny nose, stuffy nose, body aches, headaches, and fatigue. Less common symptoms are diarrhea, nausea, and vomiting. Some patients may progress to more moderate and severe symptoms. More concerning symptoms are having a high fever, shortness of breath or difficulty breathing, altered consciousness or confusion, and seizures. Potential complications that can be life-threatening are pneumonia, respiratory failure, acute respiratory distress syndrome, also known as ARDS, acute kidney injury, multi-organ failure, sepsis, septic shock, and inflammation of the brain, which is called meningoencephalitis. These would require admission to an intensive care unit in a hospital. Now let's talk about the timing of symptoms. Symptoms in humans usually begin about 3 days after exposure to the virus, but they can appear as early as 2 days or as late as 7 days after exposure. But eye symptoms like redness and irritation can develop sooner than just a day or two after exposure. So be on the lookout for eye redness in yourself, your kids, and those around you. Once bird flu sets in, the symptoms will last a few days to less than 2 weeks. However, in people with severe illness like respiratory failure, they may remain sick for several weeks. Now, let's discuss the contagious period. For individuals with mild illness, the contagious period is not fully understood, but is believed to be similar to that of seasonal flu. People are thought to be most contagious during the first few days of illness. Those with severe illness, such as pneumonia, may carry high levels of the virus in their lower respiratory tract and could remain contagious for several weeks. The data on bird flu in humans is limited as it is still emerging as a new potential threat. Interestingly, some people infected with bird flu report no symptoms at all. However, even asymptomatic individuals may still spread the virus to others, making the disease challenging to track and contain. In order to protect yourself from bird flu, you should avoid contact with infected birds, which applies most to people who work with animals. If you see dead birds in your yard, be sure to keep your pets and children away from them. Bird flu has also been detected in dairy cows, so do not drink raw milk and do not consume raw meat products. If someone has a red eye, avoid close contact with them and have them be tested for bird flu. As of January 28th, 2025, there is still low likelihood of human-to-human transmission. But we do know that the virus is capable of mutating, and this is possibly what led to the first human death of bird flu.